Okay.
Yes.
Okay. Okay, done. I hope it is clear. Audio, video is clear.
Yes, sir.
Yeah, yeah.
Yes, sir. Yes.
So how to interpret the BI-RADS? So if BI-RADS 0 is given, the scan should be repeated. If BI-RADS 1 is there for a breast lump, BI-RADS this mammogram is done. If BI-RADS 1 is there, then it is negative for carcinoma. If BI-RADS 2 is given, it is a benign lesion. It is not carcinoma. It is not cancer. If BI-RADS 3 is given, it is probably a benign, but short-term follow-up. Every 6 months we should follow up. And there is a very low possibility, less than 2% will turn out to be malignant.
Sir, please stop for interrupting you.
Ah,
What is benign malignancy
okay,
and what is carcinoma?
okay, okay.
Okay.
Benign is,
Yeah.
it is not cancer. If there is a lump which is not harmful, that is a benign. Malignant means it is a cancer. So the synonym for cancer or carcinoma is malignant. Benign means it is not cancer. So whenever BI-RADS 2 is given, it is not cancer or carcinoma. If the BI-RADS 3 is given, it is probably benign, but there is a chance of developing carcinoma in 2% of the cases. So follow-up should be done if BI-RADS 3 is given. If BI-RADS 4 is given, it is a suspicious. It may be a carcinoma. Around 2 to 95% of these cases will turn out to be cancers. So if BI-RADS 5 is given, it is a highly suggestive carcinoma. 95%, greater than 95% of them are turn out to be cancers. If BI-RADS 6 is there, already the patient underwent biopsy. It is a known case of carcinoma. Then it is given a BI-RADS 6 and surgical excision. That lump or mastectomy is to be done. So BI-RADS 4, 5, 6. This is where we get the problem. 6 is a proven malignancy. 5 means it is a highly suggestive of malignancy. Then we do the FNAC. We put a needle into the lump, we aspirate the cells, see under the microscope, confirm. So in case of breast carcinoma, triple test is done. The triple test means whenever a doctor palpates the tumor, if it is fixed, if it is hard, and if it is not moving, if the skin or the swelling is puckering of the skin, if there is a pseudo-orange appearance of the skin, if there is a retraction of the nipple is seen, he will put a query and he will say it is carcinoma. He will put a question mark and he will write as carcinoma breast. He will send it to the radiologist. Radiologist will give his opinion, highly suggestive or suspicious of breast carcinoma. Then finally the patient will land up in a pathologist. So the pathologist will put a needle in the breast lesion. He will aspirate the cells, see under the microscope, and he will confirm the diagnosis. If all the three are positive, then it is carcinoma. Then lumpectomy or mastectomy has to be done. Mastectomy means removal of the breast completely along with the bit of skin.
Sir, again, sorry for
Uh,
interrupting you, sir.
yes, yes.
You are going so fast.
Very fast. Sorry. Okay, sorry. Okay. So whenever we
Sudhakar
get,
sir,
okay, I will
yeah,
be a bit slow.
okay.
Whenever
It
BI-RADS,
should be a slow thing. Okay.
okay.
Sorry, sir, for interrupting you
No,
again.
no, no, no. I got
Yeah.
your point because all this thing is done mainly to help our dietitians to interpret the
Mm,
reports. So if their
mm.
BI-RADS report is 1, 2, or 3, then there is no problem. If the BI-RADS report is 1, 2, 3, there is no problem. If the 3 is given, we'll ask them to come for every 6 months. And less than 2% will develop cancers. If BI-RADS 4, 5, 6 is there, 4 means it is a suspicious. Around 2 to 95% of the cases of these lumps will turn out to be malignant. If 5 BI-RADS is given, it is suggestive of malignancy. So usually when a patient presents with a doctor with a lump in the breast, the doctor will examine. He will see whether the lump is firm in consistency or hard in consistency. If it is hard in consistency, it is a doubtful lesion. Along with the hard in consistency, if it is fixed, if it is not moving on palpation, normally the breast lump will be moving. But if it is fixed to the underlying skin or if it is fixed to the muscle, underneath muscle, then it is suspicious because carcinoma will infiltrate into the underlying tissue. So that is where the clinician will diagnose as choriocarcinoma. He will send to the mammogram. mammogram will give either 4 or 5, highly suggestive of malignancy or suspicious. So then the patient will come to the pathologist. The pathologist will put a needle into the tumor, aspirate the cells, observe the cells under the microscope.
Sir,
Yes.
sorry to stop you again. You are going too fast, sir.
Okay.
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 What is the muscle? What is the difference between fibroadenoma and a lump?
Okay.
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 Is there a difference?
Okay. Lump is a clinical terminology. Fibroadenoma is a pathological terminology. So a lump can turn out to be a cyst, or it can be fibroadenosis. Whereas a fibroadenoma is a non-malignant tumor. Non-malignant tumor arising in the breast is a fibroadenoma. Whereas a malignant tumor arising from the ductal epithelium is carcinoma or cancer. So the pathologist will finally
Sir, again, stopping you for this, but what is ductal epithelioma and fibroadenoma?
Okay. So from the duct, both are benign. If there is any tumor arising from the ductal epithelial lining, a fibroadenoma, it is a biphasic tumor. It is a tumor arising consisting of the ductal epithelium along with the fibrous tissue. So that is a fibroadenoma. It is a non-cancerous condition. So there is the